Good morning.
Hi,
How are you guys doing?
I'm good. And yourself?
I'm doing all right. I am doing all right. I wanted to see if anyone else would join, but maybe they will in a little bit. Um, so yeah, how's your tooth?
Um, I'm getting my teeth pulled out on March the 30th.
Oh,
Yeah.
so do you have to just deal with the pain all the way until
Oh
then?
no. Oh no. I already went and they gave me some medication, like
Oh,
antibiotics. Yeah.
oh, good. Oh, okay. I was like, oh my gosh.
No.
Okay.
No. Thankfully, no. I don't have to live with that.
Yeah. Okay.
Yeah.
Okay. That's good. That's good. So, all right. Well, good luck during that
Thank you.
procedure. They're pretty easy, but yeah. Um, all right. Well, I guess we could start because this is kind of um, a little bit of a lot of information in here. So, um, all right. So we'll be talking, I'll minimize you guys over here. Let's see, maybe bring you down here. So this one's all about pregnancy, fertility, childbirth. So, a little bit, this is just a background or a history on pregnancy. A long time ago, it was a lot of women and children died during childbirth. It was not an easy process. It is still not easy. It is probably the most risky thing that a woman can do. But with advanced, medicine and doctors and hospitals and technology, they've really reduced the amount of mortality during childbirth. So that's good. Here it's saying, really a 99% chance of a child surviving, and then, fewer than 2 in 10,000 pregnancies lead to the death of the mother. I know we hear about stories like that in the news, but you have to keep it in perspective. They put stories like that in the news because it's sensational. Don't think that it's something that happens every day, or that it's a very, very common occurrence. It's pretty rare nowadays. So here's just a few pictures of the process of fertilization, and we'll go into all of these. You guys have probably covered this either in biology or, what do we talk about not an intro, in human growth also. So fertilization takes place out in the oviduct or the fallopian tube. The egg, once it pops out, the fallopian tube takes it up, and the egg will stay right there, and she'll wait for the sperm to find her, or sperm will already be there. So fertilization takes place way out in the fallopian tube. It takes about 10 to 14 days for that fertilized egg to make its way all the way down the fallopian tube and then get into the uterus. In the uterus is where that fertilized egg, or what we call a zygote, this is where it should implant. So during those first 10 to 14 days, the female is not considered pregnant. She wouldn't know she even has a fertilized egg. It's not until implantation occurs that she is technically considered pregnant. And that could be upwards of 2 weeks after fertilization. As soon as at that point, it would be a blastocyst. As soon as the blastocyst implants into the uterine wall, the mom's body recognizes it. And this is where you can see here that she will start secreting this human chorionic gonadotropin. This is the hormone that is actually picked up on the pregnancy test, or like I like to call it the pee stick. So if you have to go and take a pregnancy test, this is what it's going to pick up on, that hormone. They're fairly accurate. They do have a lot of false negatives. That's the most common error that this test would make. It would say that you are not pregnant when in fact you are. And this is probably because it's not picking up enough of the hormone. Okay, so they really recommend that you use that very first morning pee or urination, so that hopefully that urine will have a high concentration of that hormone. If you take it later in the day and you've had lots of water and, you know, Coke or tea or coffee or something like that, then it can really dilute your urine and it won't pick up on the hormone. Obviously, a pregnancy test or the blood test would be the most accurate. And then, of course, an ultrasound. But an ultrasound won't. It's really kind of cool. As soon as the blastocyst implants onto the uterine wall, there's a time that it completely goes into the uterine wall. So if you did an ultrasound, you wouldn't see that she's pregnant because it's within the tissue of the uterus. And then eventually it pops back out again. So they won't do an ultrasound until about 6 weeks. So that's kind of a cool fact right there. This is why if you find out that maybe you're pregnant or you think you are and you call the doctor, they'll probably schedule you for a doctor's appointment, not until they count that it would be about 6 weeks. So here's just a little, shows some slides here of what is happening actually with the zygote. We call it a blastocyst once it turns into about 100 cells inside of there. When it's a blastocyst, it will break out of this hard outer shell called the zona, and you'll see that this is when it kind of spills out and it attaches itself to the uterine wall. Okay, during this about 2-week process, this is its journey that it's making all along the fallopian tube, and then it turns along in here and then hopefully implants. Oh, okay, sorry, we already talked about that. I love it when the slides read my mind. So yes, pregnancy tests are less accurate. You know, I think most young girls or even older girls, if they're scared of being pregnant or hoping to become pregnant, either of the two, they usually buy more than one test. So we do recommend that to buy, you know, a couple tests, maybe a couple different brands of tests, and take them and see, you know, which ones tell you you're positive or not. You know, obviously an ultrasound is going to give you definite results. So here's one of those pee sticks that I was talking about. They've made them much more easy to read. It used to just be lines and you had to figure out which 2 lines and 1 line and so on. So these here now, the digital ones are really nice. Okay, so obviously some individuals are what we call subfertile or infertile. Okay, subfertile means less than optimum, right? You're not completely fertile. It's going to be harder for you to get pregnant. And infertile is you can't. Okay, you can't get pregnant or you can't get somebody pregnant. So they say about 12% of couples look for help with fertility doctors. There's lots of different reasons why people could be subfertile or infertile. For males, it's a little bit easier. Well, okay, let me back up real quick. So if you and your partner are trying to get pregnant and it's been a couple months and nothing's happening and you try and go to a doctor, they're going to send you home and they're going to say you have to wait a complete year. Okay, so you're considered subfertile if you cannot become pregnant within a year. And of course, this would be no contraceptives or anything like that. So, so within a year, you know, about 85% of couples will become pregnant, okay, if they're not using any method of contraception. So, okay, so the years pass, now you go in and you say, okay, we can't get pregnant. The first thing they're going to do is look at the male because it's easier. So he would leave a deposit of his semen, and the doctors can look at it and they can see whether he has any sperm, or if there's something wrong with the sperm, or if he just has a really low count of sperm. Okay, so say you get news back that you just have a low count of sperm, there's lots of behavioral things that you can do to change that. So certainly no drugs, no really watch alcohol intake. It may be certain medications that the person is on. It may be diabetes. It may be various other medical conditions that I'm not going to pretend to know. It may be lifestyle, kind of like they might ask you to lose weight. They might ask you to start exercising, have a better diet. You also want to watch for things like laptops. If you're always having them on your lap, it's too hot, and so the sperm can die. Really tight jeans, tight underwear. If you're a cyclist, and you're always wearing those kind of like spandex or something like that. So it would be just, there's lots of different reasons that you could have low sperm count. So with life changes, a lot of times you can get sperm count back up. So, okay, now let's say it's not the male. He has plenty of sperm. I think they count it over, if you're under 200 million sperm in one ejaculation, then that's considered low sperm count. If you're over 200, you're okay. A typical male has anywhere between 400, 500, 600 million sperm in one ejaculation. Okay, so females, the females, it gets more complicated, right? It can go two ways. They can either not get pregnant or they can not stay pregnant. Okay, and so how that happens, there's different reasons for guys. There's for girls, there's a defective sperm with 3 tails. Okay. Oh, it doesn't, what? We don't go through girls? That's so weird. Okay. Well, maybe it does. Well, here's kind of, I'll go back to those other ones. So for girls, if you can't get pregnant, this is something wrong with the ovaries. Maybe she does not have eggs. Maybe she has eggs in there, but for some reason she doesn't ovulate. There might be too much scar tissue. Maybe there was something wrong with her fallopian tubes before, and so she ovulates, but there's something blocking the sperm from getting to the eggs. So lots of different reasons there. The other side of it, why she wouldn't be able to stay pregnant is, so she ovulates fine, fertilized, egg becomes fertilized, it travels down. Maybe at this point, maybe it never implants, maybe it doesn't stay implanted for whatever reason. And so problems there is, like it's saying here, she could have uterine fibroids, a lot of cysts and tissue overgrowth, endometriosis. This is a very thickening of that lining, the endometrium inside of the uterus. So there could be a number of reasons why she wouldn't be able to maintain a pregnancy. So if you have one of these problems, depending on which route it goes, you know, say the male doesn't have any sperm, you can obviously go to a sperm bank and get sperm from a donor, and then they could either artificially inseminate it into the female, or they could mix it with her eggs. If she doesn't have eggs, you could go to an egg bank and you could get a donor eggs, mix it with the dad's sperm, and then they could implant it in her, and at least she could carry the child. If she can't maintain a pregnancy, there's a few things, right? They could try and like scrape DNC, they could try and scrape the inside of her uterus to get rid of those cysts and fibroids, and maybe it would implant at that point, or she might just have to get a surrogate, another lady to carry her child. So they would still get her egg and they would get dad's sperm and they'd make a little embryo and then they'd put it into this lady. So it's not biologically that lady's, it's biologically their child. She just carries it for them. So there's lots of different options nowadays for these things. So here's just showing a few ways that they can mix and put eggs and stuff. So they call that ART, Assisted Reproductive Technology, ART. So obviously adoption, you know, is another route that families can go to get kids. So here they're just talking a little bit about older children, or I'm sorry, older parents tend to have a higher risk for babies with Down syndrome, you know, some sort of physical malformation, mental conditions, things like that. We also see autism is more likely with the age of the father. So, you know, the older the couples get, you know, we tend to see more problems. So here they're saying a large percentage of embryos are genetically abnormal, or they just completely, they just never grow into a viable baby. It's believed about 50% of fertilized eggs never make it to you know, fetus form, or never born to be a baby. So that's a lot of you know, mixing of eggs and sperms that they're just not going to make it. It just doesn't work. And so we see a lot of miscarriages. So that is something, I think they say 1 in 10 pregnancies end in miscarriage. If she's over 35, maybe 40, but I want to say 35, 1 in 5 pregnancies end in miscarriage. So miscarriages are very, very common. An ectopic pregnancy is when implantation happens not in the uterus, not where it's supposed to, and usually that's somewhere in the fallopian tube. Unfortunately, this is a pregnancy that will be lost. They have no technology right now of being able to take it off of the fallopian tube and then reimplant it into the uterus. So that pregnancy will be lost. If she doesn't know that she has an ectopic pregnancy and that embryo continues to grow, it can cause that fallopian tube to rupture. And at that point, she's going to be in a lot of pain. She would be rushed to the hospital, but this is life-threatening. There's so much blood that goes to the uterus and the fallopian tubes that is a dangerous situation. So here's a picture showing an ectopic pregnancy. Okay, that will not be able to be sustained. So due date, they count it, you know, about 9 months or so. It's really, when you go in, you find out that it's like they really count like 10 months because like 40 weeks, but they include in there from fertilization. So usually girls don't find out that they're pregnant till about 6 weeks. That's the most common. So you've already got down, you know, a month and 2 weeks. So about 9 months is what they say that you're going to have. And it varies, you know, it just varies. Your doctor will tell you how things are going and how you're progressing. So here's a few pictures here. This is what we would call like well, it's an embryo, but it looks, you know, it's more of a neural tube, right? Lots of good blood right there. You can see vertebrae are starting to form. This will eventually be the brainstem and the head. Just 1 week later, right? A lot of growth, rapid growth here. You can see this ginormous head, an eye, an arm, and a leg already forming. This is kind of a weird color, you know, really be bright red. This is the amniotic sac all around here that has all the fluid inside there. Kind of start to see a little bit of a nose forming. In this one, you can't see that because I have this down here, but that's 9 weeks. Okay, at 9 weeks. So this is technically when a baby is considered a fetus. 8 weeks, it's called an embryo. And then from 9 weeks on, we call it a fetus. By 9 weeks, this baby has everything that it needs. It has every organ is in place. You can see here, ears, you know, legs, feet, hands, nose, everything is in place. It's just going to do some fine tuning at that point. The heart is already working. The heart starts working at day 21 or day 22, you know, very, very early on. The brain will continue to grow through the entire pregnancy, and all the other organs, you know, start working as you know, time goes on. The lungs are the last organ that will finish up, and that's way at the end of the pregnancy. This is why a lot of babies that are born premature usually need oxygen or some sort of assistance breathing. So you can see here the changes that occur. Okay. All right. Let's see. Yeah, definitely, you know, as soon as implantation occurs, she's considered pregnant. The mom is in her first trimester. Lots of communication between the mom's body and the baby's body. Hormones are on the rise in the mom, especially progesterone, so that she can maintain that pregnancy. And all of these rise in hormones can really cause a lot of problems with the mom. It can cause morning sickness, which really is a misnomer, because you can be sick all day or, you know, at night or whatever. It's not just in the morning. You know, breast tenderness, breasts tend to enlarge. She can get really tired. You know, pains in different ways, in different areas, frequent urination because that uterus is sitting on top of the bladder. And of course, with hormones, we can get mood swings. You know, we absolutely 100% recommend prenatal care if you're pregnant. And you should not, really in El Paso, there's no reason for you not to get prenatal care. Texas Tech, UMC, all these doctors around town will take you, will see you. In Texas, when President Bush was governor of Texas, he enacted that in Texas, if you're a single mom, you will get Medicaid, and your entire prenatal care, delivery, and excuse me, 3 months after delivery, your insurance is covered, your care is covered. And Medicaid is very good insurance. Every doctor will take it, so you don't have to go, you know, to some doctor that you don't want to. You can pick. You can go to the best hospitals. You can go wherever you want, and everything is paid for, even prenatal vitamins. So Medicaid, you would just have to go to the Department of Health and Human Services and sign up for that, but it's a really easy process, and everything is taken care of. Your child will continue to be covered on Medicaid until you have a job that it you know, you get insurance somewhere else. You unfortunately will only be covered 3 months postnatal. So, but anyways, that's something to look into if you know anybody who's pregnant. That's a really good program. So prenatal care is so important, because you know you need those ultrasounds, you need those tests, you want to make sure everything is going the way it's supposed to. You want to take those vitamins. You want to make sure you don't have any problems with the placenta or the uterus, that your life is threatened. You want to make sure that there's nothing wrong, or that the life of the baby is threatened. So it's so important to get that. Obviously, adequate nutrition here, you know, we get kind of frustrated that it says the recommended weight gain 25 to 35. That depends. That really depends. And it depends on your doctor will let you know. It depends on how tall you are. It depends on how skinny you are or how large you are. The doctor will tell you what to eat, and how to eat, and what's safe for you. Okay. So here's a little bit more you can see. Of course, BMI is going to be taken into consideration. So if she's extremely underweight, she's going to gain more weight than that 25 to 35 pounds, right? If someone is considered quote unquote normal, if you're overweight, and then if you're obese, they're going to restrict you on what you should be taking in. We don't want to get gestational diabetes. You don't want your blood pressure to go up. There's all kinds of problems that can happen in case you really want to take care of yourself. This is a nice picture that just shows how much weight and what it is attributed to, right? So muscle and fat. The actual extra blood and fluid that's in a woman's body is 7 pounds. So lots of extra fluids and stuff going on inside of her body. The breasts, of course, you know, gain more weight. The uterus itself weighs 2.4 pounds. And then you can see there an average baby is 7.5 pounds. And then 2 pounds of amniotic fluid.